Family members often feel guilty about needing to not only admit their relative into a residential aged care, but they also feel guilty about perhaps overriding their parents' decision. Their parents have always been the ones to make decisions in their life, and then suddenly they're making the decisions on behalf of their parent. Sort of role reversal. And they do feel guilty about doing that, or they feel sad that they need to do that. For every person, it's a different emotion that they go through. So it's a good idea to talk those emotions through with the carers to get some support with it. Quite often the family member that's being admitted into residential aged care will be angry that these decisions have been made on their behalf. They'll not understand. They may lack insight into being able to understand the process. So if we can explain to family members, to the family members, to step back a little bit and let the staff assist with some of those emotions that the resident is going through, so that they can still be the supportive, caring son or daughter, but let the staff assist the resident with the anger and the frustration and some of those feelings that the resident might be going through. Just gives them a little bit of a break from it. And we'd always encourage family members to come and talk to us. If someone's being particularly stressful, then if you can come and talk to us about it, then we know how we can step in and perhaps offer some diversional therapy or a different activity to take the focus off. When a resident is really struggling with accepting residential aged care and is perhaps taking it out on the family members, we spend a lot of time talking to those family members and explaining to them that it is part of the grieving process, letting go of their independence, letting go of their home. Maybe they've had to leave a pet behind in the family home. So they're sad. They're very sad. So not to take it personally when they are being difficult, making those frequent phone calls. They can sometimes, if there's some cognitive loss, they might become verbally abusive, verbally aggressive towards their relative or to the staff. But to try and get people to understand that that is part of that settling in process and that we can help them through that. So how do family members cope with those emotional challenges? Again, we would probably advise them, there are some theories that you shouldn't visit for the X number of days and then come in and visit them. I'm not a great believer in that. I think family support is wonderful and we can't manage without family support. But perhaps what we should advise the families is, if the visit's not going well and your relative's angry or upset, make the visit short. So shorter and more often rather than a long period of distress. And quite often you'll find as soon as the family's left that the resident settles down again, and then family member walks in again and it all starts again. So it's a bit of a slow process with support from both staff and from the family. I don't think one or the other can do it on their own.